Hello everyone, my name is Exotica Hall and I'm going to be presenting on the medication Lurasidone. To begin, I want to talk a little bit about bipolar disorder and what it is specifically. A lot of people have this stipulation that bipolar disorder is ups and downs, which is true. However, it is commonly associated with a change that occurs very suddenly versus over a period of time. In most cases, we understand this fluctuation as some people describe even the weather as bipolar and not being able to make up its mind. For example, going from sunny to rainy back to sunny. But what bipolar disorder really is a chronic mental illness described as recurrent mood disorder with extreme fluctuations in mood with episodes of depression and mania. And these episodes of depression and mania don't occur suddenly as most people mistaken. They actually occur over periods of weeks. And there's two common types that we know of. One is bipolar 1 and the other is bipolar type 2. And this is a commonly misdiagnosed illness, and in the United States, this affects about 12.7 million people, affecting both men and women equally. It was also ranked by the World Health Organization in worldwide causes of years lived with disabilities, surpassing all forms of cancer. And given that this is commonly misdiagnosed, there is a serious problem with it going untreated, as with bipolar disorder, there is a high risk of substance abuse, suicide, and other psychiatric disorders. And as I mentioned earlier, oftentimes depression is linked with bipolar disorder. Therefore, this specific mental illness is typically treated with an antipsychotic medication as well as an antidepressant in conjunction. So with that being said, I'm going to move on and talk about Lurasidone, also known as Latuda, which is used to treat bipolar disorder. It was actually developed by the Japanese firm seen here, Nippon Sumitomo. It is a chemical compound that is molecularly made and is in the chemical class of the benzoisothiazole derivatives. And here I've attached the image of the chemical breakdown to make this drug, and as you can see, there are a few steps taken to obtain the compound lurasidone hydrochloride. So initially, lurasidone hydrochloride was used for patients who were diagnosed with schizophrenia, and that was approved in 2010 by the FDA. It wasn't until 2013 that it was approved for treatment for bipolar depression in the United States. Now, Latuda is a second-generation antipsychotic medication, meaning that it's more effective while minimizing the possible adverse effects. For example, one side effect that we understand with this medication is the possibility of weight gain. Moving on, I'm going to be talking about the drug effects of Latuda. So there was a 6-week placebo-controlled study that demonstrated the efficacy of lurasidone in bipolar depression. And that study showed significant reduction in depressive symptoms with patients with bipolar disorder type 1 as early as 2 weeks. So this goes to show that Latuda does have an effect in reversing depression symptoms. Another study examined rats and tested passive avoidance response, and it was found that lurasidone was effective in reversing these deficits, examining that it can at least partly restore the memory consolidation process, therefore improving cognitive impairments due to bipolar disorder. And this is in part because Latuda, in comparison to other drugs, has a high affinity for the 5-HT receptors and the adrenal receptors, which are thought to be involved in pro-cognitive effects. And given this neurobiological evidence, lurasidone may provide some evidence that there's advantages in learning and memory, given these high affinities of the 5-HT receptors. Now, getting into the pharmacokinetic factors of this drug, the most common route of administration is orally, and the bioavailability is about 9%. However, some studies have shown that the bioavailability increases to 19% when taken with a recommended meal of at least 350 calories. And to reach max concentration, it takes approximately 1 to 3 hours after an oral dose. Latuda is metabolized extensively in the liver, mainly the CYP384 enzyme. So, of course, as we talked about in class, when we have genetic factors that alter the CYP384 enzyme, we can see either an increase or a slowing of the metabolism of this drug, which is, in result, has an effect on bioavailability. The product label says the half-life is 18 hours, but some studies have shown to reveal a half-life of 37 hours given repeated oral doses at a steady state. And it's excreted in the urine, about 9%, in the feces, which is 80%. So to talk about the pharmacodynamic factors of this drug, it affects both dopamine and serotonin receptors, acting as an antagonist and partial agonist. And here I've attached a list of the binding profile of this drug, and as you can see, it's mostly an antagonist, but it is also a partial agonist to serotonin, specifically at the 5-HT1A receptor. So what that means is at the dopamine receptor acting as an antagonist, it blocks dopamine from activating dopamine receptors, leading to decreased dopamine signaling. This is where the improvement of psychosis is happening. And with Latuda being a partial agonist on serotonin, this allows stability. So, for example, if serotonin levels are too high, it'll compete with the serotonin receptors to bring it back to baseline. And if serotonin levels are too low, it will allow for an increase in serotonin signaling. And so, as seen in this table, it goes over the receptor activity and reveals its effect. So, for example, acting at the D2 receptor as an antagonist, it decreases dopaminergic transmission in the mesolimbic pathways, which results in a decrease in positive symptoms observed in affective disorders with psychotic features. So, as we can see with Latuda as a medication therapy, we see mainly a decrease in depressive symptoms and an increase in cognitive function. Moving on, there wasn't a lot of information regarding physical dependence of Latuda. However, we can understand that individuals can develop a tolerance to this drug, given that there are different doses of this drug that could be administered. And as we learned in class, it's not uncommon to develop a tolerance to a drug given downregulation of receptors. Now, as far as completely discontinuing the drug, it is case by case, but typically under a doctor's supervision, it is weaned off. And it is so because it can cause withdrawal symptoms such as nausea and worsening symptoms of mood swings. One study showed a weighted average of 53% of individuals showed withdrawal symptoms after abrupt discontinuation. And this is because it's affecting dopamine and serotonin receptors, which has psychological effects on the body. Most studies also have shown that Latuda is well tolerated. Therefore, as far as addictive properties to this drug is unlikely. And given that it is a dopamine antagonist and serotonin agonist, it's not really activating the dopamine reward system in comparison to other drugs, such as opioids that we've learned in class, that can have addictive properties. So in this case, given the lack of evidence of cases of addiction to Latuda and its pharmacodynamic factors, I would make the argument that it is not addictive. And that's all I have for this presentation. I hope that you've learned something new about this drug and how it is one of the common drugs that is prescribed to help treat such a chronic illness that affects more individuals than we may know. Thank you.